Hi everyone, my name is Sana and I am a community health intern at St. Joseph Medical Center. So, a little bit about my internship. I am in person, so I do physically go into the office at St. Joseph. There are some days I am able to work at home, but I would say the majority of it is in person. We do all of our meetings on WebEx. And our community health classes, which right now are a Tai Chi exercise class and a preventing type 2 diabetes class, those are all on WebEx, and that's just due to the restricted visitor policy of the hospital. A little bit of background of the hospital. It is a part of a larger University of Maryland medical systems, and that is a picture of St. Joe's on the right. So there were a couple reasons why I chose this site. The main reason is because I actually volunteered with the community health department my freshman year at Towson. I was a volunteer at the community stroke screening, bone density screenings, the heart health fair, and then some blood drives. And during this time, I became very passionate on promoting healthy behaviors and healthy lifestyles. So I knew I had a similar vision to the department, so I was very eager to apply during my senior year. Another reason was because the distance was very close to campus where I currently live. And this makes my morning commute very easy, and I'm also able to come in on a short notice or run into the office whenever I need to. And then I also really wanted to intern at a hospital setting because I would work with a very large interdisciplinary team of healthcare professionals, and this would encourage my growing and learning experience. Some things to consider when looking for an internship site is your distance to your campus if you're living on campus or home, and then also transportation. So I know for my internship site, we have many off-site events in the Baltimore and Towson region. So we do have to travel to different schools, churches. So having a car is very essential to my performance at my internship. And then also current employment. So if you are working, that is something you have to be mindful of to make sure your internship is something you can effectively manage in your schedule. So I know for my internship specifically, there are some events that have weekend or evening hours because it is in person, and then this schedule can always change depending on when or where there needs to be an event. So that's why it would be very difficult to do this internship site if you did have another job. So the thing I liked most about my internship was it was a very tight-knit group. The community health department is comprised of 3 people, plus me, the student intern. And this made it very easy to have a really good connection with everyone. And our communication was also really effective. Every project was really a team effort. So if you needed help, it was always there. It was also a very welcoming environment. And what I also loved about this internship is the outreach. There were lots of outreach efforts, and my favorite outreach was a weekly food distribution that we do at Parkville High School. And it was a great way to connect with people in the community while still addressing the issue of food insecurity, which still exists regardless of the pandemic. What I did dislike about the internship was that I did wish there were more in-person activities, such as health fairs, more conferences, and community screenings. That's how I prefer to make connections face to face, but obviously this could not be done due to safety reasons, due to COVID and the guest restriction policy, visitor restriction policy. So that is understandable, and obviously that is out of my control. Something that I learned at Towson that was very useful for my internship is using Excel for data entry, management, and evaluation. So, learning about Excel was very, very useful in my internship. And I use Excel, and using it really makes data entry a lot easier and efficient. So, in my classes, I learned how to use different shortcuts on Excel, also learning how to manipulate and change my data, graphing my data, organizing my data in different graphs or scatter plots, interpreting my data, so understanding what it means and what it represents. All of these tools and tricks were very useful, and it's something that I can implement in my internship and moving forward. Something that I wish I learned at TU that I didn't was I wish I learned more about targeting or changing educational programs for specific populations. So, more so targeting my education and understanding that it needs to be flexible. So, there are many types of populations that my internship serves. There's many types of communities. We have programs that are targeted for children, for adults, for families, for elderly, for women. So, it is very important to be flexible because our community is so diverse and it will continue to be diverse. So we really want to make sure we adequately meet their needs. So it's very important that you learn how to target your population with the materials that you present. So this is just some of my advice that I have for the Health 315 students as they are finishing their classes and entering their internships. My first one is to network. You really want to be professional in your interactions with everyone in your internship. And what's great is that you are already expanding on your network when you land an internship. So you really want to use that to your advantage. You want to use every day as an opportunity to keep networking and introduce yourself because you'll have the opportunity to meet many new people in your internship, and that will open a lot of doors, open a lot of opportunities. So, you really want to take advantage of that. Another thing is learn. You want to use each day at your internship to grow as a professional. You will learn from your colleagues, your supervisors, and also your interactions with the community. So I can confidently say that every day at my internship, I am learning something new. And there is always more to learn. There's no limit on what you can and can't learn. You're going to learn a lot about yourself, not only in your classes, but also in your internship experience. And hopefully, you'll learn through your internship what you are really passionate about. And the internship is a great way for if you aren't really sure what you want to focus on or what you are really passionate about in terms of health education. The internship is a great opportunity to help expand on that. So once you learn about what you are passionate about, you'll know how you want to give back to the community. You may find out you have a passion for a specific topic, and then so you can use that passion to really provide valuable information and resources to your community. And that's all that I have for my presentations. If you have any questions, please let me know. Have a good one.